What happens when people buy the shiny object of technology and they don't have the strategy behind it? They have missing pieces and it becomes clunky to them and they don't get the value add that they were promised.
The problem isn't a lack of tools, it's how disconnected they've become. And as demand and complexity grow, that disconnect becomes harder and more costly to manage. That's where intelligent care changes the equation. Intelligent care digitally orchestrates care delivery across the enterprise, aligning people, processes, and technology into one coordinated system.
Huron will always lead with strategy because it's about accountability and it's about the operating model and it's about decision making.
Huron comes into play as being able to say, what's your use cases? What are your workflows? What are you trying to achieve? And let's build out the best systems possible.
Sometimes it's not buying the very expensive piece of technology. Sometimes it's actually optimizing what you currently have.
We should start with the investments that have already been made and then take a look at the foundational layer of the data and then maximize their current investments and then identify where there are gaps and then go fill those gaps.
Then bring those capabilities together in a way that's designed to work across the entire organization.
You have EHRs, you have AI, machine learning, bots. They're all created and they have all been put on top of an individual problem, but we're actually connecting them all so that for the clinicians, we are able to provide them with that real-time information to be able to give them the answers that they need.
That's when performance starts to change.
Better capacity management, so both an improvement on things like overall patient flow and length of stay, as well as the core ability to see more patients that need care. The other areas that we see are really giving tools to staff to be more productive, to operate at the top of their license. That can also lead to increased retention, staff satisfaction, and certainly patient satisfaction.
That's intelligent care in action, and on the front line, the difference is immediate. Intelligent care removes the friction that often gets in the way of delivering for patients.
Think about documentation. You're solving to help support the nursing staff and how they are going to save time at the bedside with having to be at the computer. That's a win, right? And then you talk about the patients, well, they're getting more time with their nursing staff or more time with their doctors to ask the questions that they want to.
Intelligent care isn't just about efficiency, it changes how care is delivered every day. Across the enterprise, that means fewer delays, clearer decisions, and a system that's easier to manage.
The financial benefits that you can't ignore, but more than that, there are all of the clinical benefits from the patient experience. And really being able to get more patients in the door more efficiently ultimately improves the experience, the outcomes of your patients, and it helps the economics of the health system.
That's the difference with Huron and what intelligent care makes possible. See what intelligent care can make possible for your organization.